Hello everyone. Today we are going to study psychiatry. I will be beginning with mood and trauma related disorders. Let's read the question first. A 42-year-old man is brought to the clinic by his sibling. He has been drinking excessively after he was denied promotion at work 4 days ago. He spent the entire weekend in bed. Although he usually drinks alcohol socially and has no prior psychiatric history, he is now feeling dejected. He has no suicidal ideation but does express uncertainty and frustration about his future. What is the most likely diagnosis? A. Adjustment disorder. B. Alcohol abuse. C. Hypomania. D. Major depressive disorder. E. Persistent depressive disorder. Let's look into the various mood and trauma related disorders first. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, a mood disorder is a mental health condition that primarily affects a person's emotional state. It can cause significant disturbances in mood, leading to feelings of sadness, emptiness, or extreme mood swings. These disorders can impact daily functioning, relationships, and overall quality of life. You can see the list below. This includes major depressive disorder, bipolar disorder, and its various types, along with dysthymia or persistent depressive disorder, seasonal affective disorder, substance-induced mood disorder, and mood disorder due to a medical condition. Trauma-related disorders, on the other hand, are defined as mental health conditions that arise following exposure to a traumatic or stressful event. These disorders are characterized by symptoms like intrusive memories, avoidance, negative mood, and hyperarousal. These include the following: post-traumatic disorder or PTSD, acute stress disorder, and adjustment disorder with mood disturbance. Let's start with the mood disorders first. I'm going to be highlighting the various important key points regarding each disorder. Let's start with major depressive disorder, which is quite commonly found. According to the DSM-5 criteria, it lasts greater than or equal to 2 weeks. 5 or more of the following symptoms must be present within the same 2-week period, and at least one symptom is either a depressed mood or loss of interest or pleasure. Keep in mind that it is always important to rule out bipolar disorder by screening for a manic or hypomanic episode. Don't stress about how you will learn these symptoms because we are going to use a very simple mnemonic to keep these in mind. The mnemonic is SIG-CAPS or SIG-E-CAP. S stands for sleep changes, including insomnia or hypersomnia. I stands for diminished interest. G stands for excessive guilt. E stands for loss of energy. C stands for concentration, which is diminished. A stands for appetite, which is also changed significantly. P stands for psychomotor agitation or retardation. S stands for suicidal thoughts, which can be recurrent. Moving on, this diagnosis is majorly found in patients who have suffered significant losses, including bereavement, natural disasters, or disabilities. First-line treatment for this includes cognitive behavioral therapy, selective serotonin reuptake inhibitors, or antidepressants like citalopram, fluoxetine, and sertraline. Alternative treatments also include SNRIs, electroconvulsive therapy, or ketamine. CBT, or cognitive behavioral therapy, is a structured, time-limited psychotherapy that helps individuals identify and change their negative thought patterns and behaviors to improve emotional well-being. Keep in mind that this is the first-line treatment of MDD, followed by SSRIs. Next, we have the bipolar disorder. The criteria for bipolar disorder and its various types can be better understood when we have gone over the concept of mania and hypomania. Now, what is a manic episode? A manic episode is characterized by elevated, expansive, or irritable mood. These symptoms must last at least greater than or equal to 1 week or any duration of hospitalization or significant functional impairment, along with the presence of 3 or more of the following. Now you can remember these by the mnemonic DIG FAST. D means distractibility, I stands for impulsivity, G for grandiosity, inflated self-esteem, F stands for flight of ideas, A stands for increase in activity, S stands for sleep disturbance, and T stands for talkativeness or pressured speech. On the other hand, the hypomanic episode is characterized by a distinct period of persistently elevated mood, lasting at least 4 consecutive days. It is not severe enough like a manic episode to cause functional impairment, and there are no psychotic features. Coming back to the criteria for bipolar disorder, bipolar type 1 includes greater than or equal to 1 manic episode, along with a hypomanic or depressive episode that can be separated by any length of time. Bipolar 2 disorder includes 1 hypomanic episode and 1 depressive episode with no history of manic episodes. Cyclothymic disorder is a milder form of bipolar disorder fluctuating between mild depressive and hypomanic symptoms. It must last greater than or equal to 2 years, with symptoms present at least half of the time, with any remission lasting less than or equal to 2 months. As I mentioned earlier, it is always important to screen for bipolar disorder before reaching the diagnosis of MDD, as antidepressant use can destabilize the mood. First line treatments for bipolar disorder include mood stabilizers, which are lithium and valproate. Antipsychotics may be used, which include quetiapine, olanzapine, and aripiprazole, which can help manage mania and mixed episodes. Alongside this, cognitive behavioral therapy is also advised. Alternative treatments include lifestyle modification, electroconvulsive therapy, and ketamine. Other mood disorders include persistent depressive disorder and seasonal affective disorder. Persistent depressive disorder is also called dysthymia. Dysthymia is characterized by depressed mood for greater than or equal to 2 years and greater than or equal to 1 year for children and adolescents. Symptoms are never absent for greater than 2 months during the last 2 years. Greater than or equal to 2 of the following symptoms must be present. These include poor appetite, insomnia, low energy, low self-esteem, difficulty concentrating, and feelings of hopelessness. A major depressive episode may occur during the 2-year period but not required for diagnosis. Seasonal affective disorder, or SAD, is characterized by a major depressive episode during a specific season, like fall or winter. Symptoms must be present for at least 2 consecutive years, with episodes occurring in the same season. Full remission of depressive symptoms must occur in the non-symptomatic season, like in the spring or summer. Other mood disorders include substance-induced mood disorder, which may be due to alcohol or cocaine consumption, and mood disorders due to a medical condition, like depression associated with hypothyroidism or bipolar associated with multiple sclerosis. It is always best to rule out any underlying pathology. Moving on to trauma-related disorders, first we have PTSD, or post-traumatic stress disorder. PTSD can occur after experiencing or witnessing a life-threatening event, for example, accident, injury, war injuries, rape, or witnessing death. Symptoms last for more than 1 month and cause significant distress or impairment in functioning. Key symptoms can be remembered by the mnemonic HARD, since PTSD is hard. H stands for hyperarousal, A stands for avoiding reminders of the traumatic event, R stands for re-experiencing flashbacks or nightmares related to the event, and D stands for distress and changes in cognition or mood. Treatments include cognitive behavioral therapy, selective serotonin reuptake inhibitors, venlafaxine, and prazosin can help reduce nightmares. This is a significant high yield point and must be remembered clearly. Now, if the PTSD symptoms last for a shorter duration, between 3 days to 1 month following the traumatic event, this is going to be characterized as acute stress disorder. So it is essential to remember the timelines when diagnosing a particular case. Lastly, we have the adjustment disorder. This is a condition characterized by emotional or behavioral symptoms that develop in response to an identifiable psychosocial stressor, like divorce, sickness, unemployment, or marital difficulties. Symptoms occur within 3 months of the stressor and last for less than 6 months after the stressor has ended. Key symptoms include anxiety, depressed mood, with crying or feeling dejected, emotional outbursts, or trouble focusing on tasks. First line therapy includes cognitive behavioral therapy, and usually medication is not indicated. You may be presented with an option such as adjustment disorder with depressed mood or fluctuations in mood. Coming back to today's question, here we have a 42-year-old man who has been drinking excessively after he was denied promotion at work 4 days ago. He spent the entire weekend in bed. Although he usually drinks alcohol socially, he has no psychiatric history. He is now feeling dejected. He has no suicidal ideation. What is the most likely diagnosis? Now, as we can see that the timeline of the events is not supporting a diagnosis of major depressive disorder, nor is it fulfilling the criteria of the mnemonic CIGI-CAP. 9 symptoms which would diagnose him as having clinical depression. So in this case, the most likely diagnosis is adjustment disorder. This fits in because the man's emotional response, feeling dejected and frustrated, is in reaction to a specific stressor and does not indicate more chronic mood disorders. While he has increased alcohol consumption, The focus is more on his emotional state and reaction to the stressor rather than the pattern of alcohol use itself. Hypomania is also ruled out because that is characterized by elevated or irritable mood. Persistent depressive disorder or dysthymia involves a chronic form of depression lasting for at least 2 years. And since this patient does not have such a history, so this diagnosis is not applicable. Please feel free to go over the answer explanations. Here is the key point. So far, we have tried to touch every topic and system. I will be sharing more on the ethics and behavioral science questions as well, so stay tuned and don't forget to subscribe and share.